Now, it's that time of the fortnight. Our foot specialist, Lina Wood, is with us, our podiatrist. How are you this morning?
Great, thanks, Sam.
Now, we're talking about bunions. Now, for a start, it's even a word that conjures up all sorts of images.
Yeah.
You say bunions and people go, ooh, bunions, even if they really don't quite know what they are.
Yeah.
So, first of all, what's a bunion? How do you know one when you see one?
Well, it involves the big toe joint, and it's actually a slow dislocation of the big toe joint, which actually stops your foot from working well.
A slow dislocation.
Well, so it just sort of gradually deteriorates into...
Oh, okay.
So where your big toe joint is, that pokes out,
Yep.
so it makes it very hard to fit into shoes, and you get rubs, okay?
Now, I have seen a lot of high heel wearers with bunions.
Yeah. Well, I feel that, wearing high heels is not great for your feet. However, I do feel if you're going to get bunions, you're going to get bunions,
right.
because of what you've inherited from your parents generally.
That's it, blame your parents.
Yeah, often your joints move too much and you've got an unstable bone shape. And what happens is your big toe joint starts pointing towards your second toe, and then there's a bit of a cascading of events that happens within your foot, which is not ideal, really. Yeah.
Right. So let's go for the early stages first, because
Yeah.
we know that what we've learned so far this year from you is everything is treatable.
Yeah,
Everything
yeah,
is manageable
absolutely.
and treatable.
Yep.
So what are the early
Foot
signs?
pain's optional.
What are the early signs that you might be on your way to getting bunions?
Well, you start noticing that your toe that it's bulging out the
So you
side.
can see it straight away.
Yeah,
Okay.
but also that the big toe is starting to move towards the second toe. Yeah. What can happen with time is the second toe starts popping up, so a structure releases underneath there, and that can be quite painful. And then that second toe, the top of the toe, can start pushing up into the shoe. Yeah, it's great, isn't it?
I'm just here thinking that this in slow motion. If you could speed all that up, what that would
be
look
quite
like
cool
to watch the structure of the foot
I have not seen some
deteriorate like
imaging
that.
of that yet.
There you go. There's a task for you.
On the top of the foot, there starts to become the bunion joint itself, so the big toe joint, starts to become arthritic within the joint and underneath the joint. Also, what happens on the top, further up the foot, on the top of the foot, there becomes an arthritic scenario as well, and people start really limping and
Right.
getting a lot of foot pain.
So, okay, by this stage, when you're sore, that's usually the time when you go, better go see somebody about this.
Yeah, it is.
So they're off to the podiatrist. What can you do to manage
And often this
bunion
happens
then?
over summer when you're wearing less sound footwear and you've been flipping around in thongs and bare feet. Because people with bunions generally have a very unstable foot type.
Right.
And it's one that needs a more supportive shoe. It needs an orthotic, to really look after it for the long term for the joint health.
So I'm going to ask you a question here. If you're in your 40s and 50s and you don't have bunions and you've been wandering around in barefoot for ages and high heels,
I don't think you're very likely to get them.
Okay,
by then.
so by now you're pretty safe because your foot's pretty stable.
Yeah,
and you would have noticed a problem with the structure.
Absolutely.
Okay.
Yep. If you look to your parents and your grandparents, I think that's where you're going to find whether you're probably at risk of developing a bunion. Children can have bunions.
Right.
Yeah.
So it's something to do with the foot structure, so get it sorted early.
Yeah. With respect to kids, like some people with bunions won't get the problems. A lot will, down the track get problems. So it's worth being preventative with your care, so seeing a podiatrist.
What can you do to get this sorted?
Well, you would see a podiatrist and we'd assess you and we'd work out where we think the problem's coming from and we'd address that to help prevent the deterioration, but also to look after the rest of your joints.
Can you reverse it?
We'd be talking orthotics, more supportive shoes for 80% of your wear time, like when you're at work, getting all those factors right, getting the width of your shoes right. There's a little, you can get... Often it's just a width issue, but when people have really bad bunions, we've got specialised shoes that have little cool expansion gussets and stuff like that, so that you're really comfy, because shoes do become a real issue for people who do have bunions.
Can you reverse it? If someone presents to you and they've clearly got some issues, is it something, if it's been a slow dislocation, is it the sort of thing that can be reversed?
No, because if you think about how many joints you have and the forces coming through your foot, the only thing that will really straighten that is surgery. And it's it sounds so simple, just lop off that bunion, but it's really quite a very involved procedure that needs to be done in a way that your foot still functions really well. And it's a really slow recovery because you're walking on it, so it's sore for a long, 6 months plus usually, so it really does affect your lifestyle in that
manage
time.
the pain whilst you're going through getting all of your orthotics and everything sorted. Is there something you can do apart from popping any pills? Is there something you can do to manage the pain of that area, or does it come down? Well,
it's actually really it settles down really quickly. Yeah, so it's with respect to pain caused by bunions or in the bunion, it's really unusual that we can't settle that down within a few weeks. So it's really achievable, to get good. So we're not reversing the shape of the bunion. We're just getting your foot to function in a really nice position and looking after the rest of your joints and slowing the deterioration of the bunion by getting your foot working better.
Now, one of the main things that's come through this is it's the structure of the foot, that largely if you have something that is making you predisposed to this condition, you're likely to then have some other foot problems, because if you've got some unsound structures happening somewhere that leads you to have one condition, you're more likely to have others as well. So what are some of the, if you have bunions, what are some of the other things to keep an eye out for?
You'll tend to have hammer toes.
What's hammer toes?
So where your second toe pops up and becomes all sort of clawed up and starts hitting the top of your shoe. Okay, so a lot of people will have heel pain as well. They'll often have pain on the top of their foot that goes in a long line across the top of their foot.
So across the foot, not up and down the foot, not in line with the bones, but across, straddling the foot.
In front, so below the ankle, on the top of the foot. And there's often a line of puffiness there, and that's there's an arthritic process that's occurring there, and podiatrists can help really, usually get a 70 to 100% success rate with treating that area to settle down that pain. So there's lots of fantastic things your feet are prone to if you do have bunions.
So how do you know if you've got an unsound foot structure? Because from what you're saying, it can really set you up for problems your whole life, from childhood onwards.
Usually you'll see them when you're playing a lot of sport. So from 11 to 15, when kids really get going with their sport. And then we start... And then if you obviously continue at high-level sport, that's when we see the problems. But those unsound foot structures, if someone hasn't played sport from 40 years to 50, 65 years old is where we really see the long-term effects. And that's when it really pops up. And if people find that they really can't get away without doing anything, they've been limping around for 3 or 6 months or 5 years, and that's when everything's revealed. And with respect to their foot structure.
People put up with so much pain in their feet before they go and see somebody. So don't do that. Don't tolerate it. If it's hurting, something's not quite right.
Yes.
Go and see a podiatrist.
And it's often quite simple, So, and it's non-invasive usually.
Right. And we'll talk about that next time. Some of the leaps and bounds in treatments, from topical treatments to other treatments. We'll talk about that next time. Thanks, Lina.
Fantastic. Thanks, Anne.
Lina Wood, our podiatrist, back in a fortnight's time.